Hello, my name is Leslie Fernandez, and I am going to be talking about the danger of Xanax, the effects, risks, impacts, as well as how it impacts current college students. So, what is Xanax? The generic name is called Alprazolam. Sorry, I can't really pronounce it. Xanax is actually a medication that is prescribed to help treat anxiety. It works by helping your nervous system calm down. Although it is helpful and can treat your anxiety, there is a lot of risk, and there can be a risk for abuse, misuse, or even addiction to this type of medication. It is very important to consume this medication as directed by your prescriber. So, what does this type of drug do to your body? This type of drug is a CNS depressant, so it slows down your brain and nervous system. This depressant leads to the feeling of relaxation, sedation, and sometimes even the feeling of euphoria. This typically produces an intense feeling of calmness, relaxation, or even drowsiness, and it can occur as quickly as to 15 to 60 minutes with enough consummation time. Xanax slows down electrical signaling, which physically reduces the feeling of anxiety or panic. So this is how it helps reduce the feeling of anxiety. So, as we know, like all types of drugs, there's a lot of risks and side effects. Some of these include decreased mental alertness, impaired concentration, lower blood pressure, difficulty speaking, confusion, even difficulty concentrating, memory impairment, drowsiness, fatigue, lightheaded, dizziness, as well as muscle weakness, poor balance, slurred speech, blurred vision, nausea, vomiting, and it can even worsen your depression. All these effects can be experienced within 50 minutes of consuming and can even last up to 6 hours when taking Xanax. As for short term and long term effects, some of the short term effects are kind of like the side effects, like confusion, concentrating, impairment, poor balance, decreased mental alertness. But yet, on the long term effect, it can increase heart rate, blood pressure, temperature, and in sweating. It can lead to more anxiety. It can cause insomnia, hallucinations, have severe cravings, shakiness. Another of the major ones are seizures, mania, psychosis, as well as when taking Xanax. One of the long term effects is that you can become very addicted to it, and it is hard to let go of it when consumed very frequently. So this when Xanax can cause overdose when it is prescribed, it is normally safe. However, if you misuse this drug, it can lead to a high risk of overdose. It is relatively greater toxicity and mortality risk in overdose than any other type of drugs. Someone overdosing on Xanax may experience an altered mental status, impaired coordination, movement, slurred speech, and typically when how you treat an overdose, it's normally with the supportive care, which can look like intubation for airway management and mechanical ventilation. How it is impacting our college students, over 5 million students have misused Xanax. Right now, we have seen that it's very popular among college students and use it as a recreational party drug. And as well, many of college students are using this drug to maximize the effects of alcohol. And as well, they're misusing it to cope with high pressure situations like school, academic stress, mental health issues to help relax their stimulants. These are some tips when consuming it. Only take this drug as directed by a doctor. Do not take more of it more often. Do not take longer than how your doctor said. Do not change the dose. Make sure you know the effects you have before you drive, and never mix it with alcohol, opioids, or illicit drugs. These are my references that I use, and thank you.